So we all know moments of feeling sad or worried is just part of being human, right?
Yeah, absolutely.
Yeah.
But the material we looked at for this deep dive really makes it clear. Clinical depression, clinical anxiety,
Mm-hmm.
they're, well, they're something else
They're
entirely.
right. Not just emotions we push through or, a weakness. The sources frame them as complex medical conditions.
Exactly. And they define them by how long they last, how intense they feel, and maybe the biggest thing, the actual real impact they have on just functioning day to day.
Okay, so that's our mission here. We're diving into the source material to help you get a quick handle on what these conditions really are, their impact, and importantly, the paths to recovery that are backed by evidence.
Kind of a shortcut to getting informed with hopefully some surprising bits from the material along the way.
Let's start with definitions then. Depression. It's not just feeling blue.
No, not at all. The sources describe it as this persistent sadness or sometimes a real loss of pleasure in things you used to enjoy. And it has to last typically more than 2 weeks and really mess with how you function.
Wow. And the scale of it.
It's huge. One statistic mentioned was globally, it affects about 5% of adults. That's like 280 million people.
That's staggering. And anxiety.
Yeah.
How does the material differentiate that from, say, just normal stress?
Good question. It's described as worry or fear that's intense, feels excessive, lasts a long time, and it's often, out of proportion to the actual situation. It actively gets in the way of life. Think generalized anxiety disorder, panic disorder, those kinds of things.
Okay. And one thing that really stood out from the sources was how often these two conditions appear together.
Yes, the comorbidity.
Mm.
It's really high. The material noted almost half of people with depression also have anxiety. And in primary care, like your regular doctor's office, it jumps to over 75%.
That's incredible. Does that suggest they're related somehow?
Well, yeah, the overlap is so significant that some researchers mentioned in the sources think they might be like different phases of the same underlying issue, maybe a general distress syndrome. And often, anxiety actually shows up first.
Interesting. And the causes, it's not just one thing, is it?
No, definitely not. The sources point to a mix. There's a genetic component, like a predisposition, but they stress it's not your destiny. Then there's an environment of finality. Difficult life events matter a lot, and psychological factors too. It's complex.
Which leads to something the material really highlighted, this idea of risk versus protection.
Uh-huh. And the focus shifts really powerfully to the protection side, specifically the factors you can actually influence.
Right, modifiable ones, so things we can actually do.
Exactly. Things like building strong social connections, learning better coping skills, even regular exercise. These are presented as incredibly protective. The material reference studies showing these factors make a huge difference, even if you have a higher genetic risk. That felt really empowering.
Yeah, hope-giving. But the impact when these conditions take hold is significant. That stat about lost workdays.
12 billion globally per year. It just shows the scale. And the sources also talk about the social isolation, which is tough because connection is one of those protective factors we just mentioned. The illness itself can kind of sabotage recovery.
A vicious cycle.
Totally. And it's not just mental. The mind-body connection is real. The material notes physical symptoms too, chronic pain, digestive problems like IBS, even increased risk for heart disease. Sometimes the physical stuff is what people notice first.
Okay, but there's hope. The sources lay out clear paths to getting better, starting with professional help. Who should people look to?
The material generally points to two key professionals. Psychiatrists, they're medical doctors, so they can diagnose and prescribe medication. And psychologists, they focus on therapy, talk therapy, and psychological testing.
And often working together is best.
Yeah, the sources suggest that collaboration can be really effective, bringing both medication management and therapeutic skills together.
Let's talk therapy then. Psychotherapy, what kinds did the sources mention?
They covered a few main evidence-based ones: CBT, cognitive behavioral therapy, that helps you challenge negative thoughts and get active again; DBT, dialectical behavior therapy, which is great for intense emotions, balancing acceptance and change; and also psychodynamic therapy, looking more at root causes and past experiences.
So different tools for different needs.
Exactly. The material was clear. There isn't one single best therapy. It really depends on you and what you're dealing with.
And medication, how is that explained?
As a tool to help rebalance brain chemistry. Neurotransmitters, like serotonin. The common types mentioned are SSRIs and SNRIs. A really key point from the sources, though, is patience. It can take 4 to 8 weeks to feel the full benefit.
That's important to know, and working with a doctor is crucial.
Absolutely critical. The material stresses this. Never stop meds suddenly withdrawal can be an issue, and monitoring for side effects is vital, especially when starting, and particularly for younger people.
For moderate to severe cases, the sources seemed keen on combining meds and therapy.
Yeah, they describe this great synergy. Medication provides a sort of bottom-up biological assist, helping the brain chemistry. Therapy offers the top-down skills, changing thoughts, building coping mechanisms. They work together.
Makes sense. Beyond the professionals, though, the material put a lot of weight on lifestyle and kind of self-management.
Definitely. Not as a replacement for professional help, but as essential support. Things that create positive feedback loops. Exercise was a big one.
Right, you mentioned that earlier. How effective can it be?
The sources suggest that it can be as effective as meds or therapy for mild to moderate depression. It releases endorphins, those feel-good chemicals, and it directly fights that feeling of lethargy. It's a powerful protective factor, too.
And sleep, that came up as well.
Oh yeah, critical. It's a two-way street. Poor sleep makes symptoms worse, and the conditions disrupt sleep. The material gave some solid sleep hygiene tips. Consistency, having a wind-down routine, making sure your bedroom is set up for sleep, avoiding screens, the basics, but they matter.
And connection. That felt like a really central theme in the sources.
Hugely important. Recovery isn't a solo mission. Support from family, friends, peer groups. It's vital. Isolation feeds these conditions, so connection is like an antidote. Sharing with trusted people, finding peer groups who really get it. The material highlighted how much that offers hope and understanding.
Even simple tools like journaling were mentioned.
Yeah, just as a way to process thoughts, get some perspective. Simple, accessible.
So, bringing it all together, the picture the sources paint is that lasting recovery involves, well, everything. Knowing the condition, getting professional help, those daily self-care strategies, and leaning on your support network.
Exactly. It's an ongoing process, requires patience, requires being kind to yourself. Integration is key.
Okay, so wrapping up this deep dive, the big takeaway from the material is that these are real, treatable conditions. Help is out there, and recovery, through this kind of integrated approach, is absolutely possible.
Yeah. And then maybe a final thought, drawing from everything we've pulled from the sources. If you were to focus on just one thing from those modifiable protective factors or self-management strategies we talked about, maybe exercise or connection or sleep, which one might you start with? Either for yourself or just to better understand someone else's journey.
Something to think about. And remember, if you want to learn more or find help, the sources pointed towards credible directories and resources online that can offer guidance and support.